If you have pain on the inside of the elbow right here, you may be suffering from medial epicondylitis, also known as golfer's elbow. This most commonly affects the flexor carpi radialis muscle, but it also can affect the palmaris longus, flexor digitorum superficialis, flexor carpi ulnaris, and the pronator teres muscle. I'm going to show you some tips you can do at home to improve your strength, pain, range of motion, and functional use of your hand. The first thing we're going to do is going to be to load this tissue using a dumbbell. You want to pick a dumbbell that's light enough that you can control. We can work on progressing the weight of the dumbbell over the next 2 to 3 days, kind of increase it maybe a pound or so over 2 to 3 day increments until your pain is resolved. What you want to do here is prop your forearm up on a towel roll. I have it here on this wedge. You're going to perform an isometric contraction. So what's going to happen here is I'm going to contract my forearm muscles here on the inside, but there's not going to be any wrist or hand movement. So I'm contracting those muscles, I'm tightening those muscles up, I'm holding my wrist nice and straight, holding that dumbbell. I'm going to work on holding that for 10 to 15 seconds for 2 to 3 sets of around 10 repetitions. And this is something you can perform throughout the day. This is a low load, low threshold strategy. So this is something you can do multiple times a day to really start contracting those muscles and to promote healing. Next, we're going to perform an eccentric exercise. So what this is, you're going to flex the wrist up and then slowly lower that down into extension, really feeling that and controlling that with this flexor mass. When I get to the bottom, I'm going to use my other hand, pull this up, slowly lower this down again, pull this up again, and slowly lower it down. You're going to complete 2 to 3 sets of 10 to 15 repetitions. Then you're going to work on a controlled supination. So you're going to take your forearm in this position, and you're going to slowly work on rotating towards your palm facing upwards. You're going to take your other hand, bring it back over, slowly rotate over. You can progress to holding the dumbbell at the bottom, slowly lowering that over, and then helping that back up. That's going to work that pronator teres muscle of the forearm, and you want to complete that for 2 to 3 sets, 10 to 15 repetitions. The last dumbbell exercise is going to be an isotonic contraction. That's going to be where we have all the way into wrist flexion actively and into extension. So we're going to go into flexion and extension, completing 2 to 3 sets, 10 to 15 repetitions. Remember, you want to make sure and really squeeze and feel that on this muscle group on the inside of your forearm right here. Just like the previous isotonic exercise, I want to go back and make sure we do that supination and pronation, holding the dumbbell at the bottom, going all the way over, and then all the way back over. 2 to 3 sets, 10 to 15 repetitions. I always like to do a little soft tissue work. You're going to use one of these muscle scraping tools or gua sha tools. I'm going to go on the flexor mass here and just kind of work all the way around. You don't have to be aggressive with this. I'm just kind of going all over, all up and down my forearm, right over the area that may be really sensitive. Again, don't push too hard. The ulnar nerve sits here on the inside, so be a little cautious there. And the median nerve sits right down through the center here, so be a little cautious there. You may get some tingling in your fingers. If you do, just back off with your pressure that you're using. I like this because not only am I working on a little cross fiber friction massage for those collagen fibers of the tendon, I'm also working on kinesthetic awareness. I like to provide that kinesthetic awareness, that kind of reconnection of the tissue with the brain in the area to make for better muscle contractions. And lastly, we always want to include range of motion and stretches. We're going to go into full extension here, straight the elbow out, go into wrist extension using my other hand, and I'm going to hold that for 20 to 30 seconds. Relax, go back into that wrist extension, 20 to 30 seconds, and relax. If you pull and it's a little too much, you don't want this to be too uncomfortable, just go to where you feel that kind of bind to that pull, hold there, and then you can work towards going into more of a stretch. And that stretch is something you can do just throughout the day, whenever you think about it, really as many times as you can throughout the day. Thank you so much for watching. I hope this video helps with your medial epicondylitis or golfer's elbow to improve your range of motion, strength, and functional use of your arm and hand. Thanks so much.